that, we will close the hearing on HB 1313 and open the hearing on HB 1398 with a staff report.
Ben McCarthy, staff of the committee, briefing House Bill 1398. This bill adds 6 factors that an interest arbitration panel must or may consider when arbitrating collective bargaining impasses between adult family home providers and the state. Adult family home providers are licensed by the state to provide residential care in a home-like setting for individuals who are elderly or who have physical or developmental disabilities. Adult family home providers are individuals, partnerships, corporations, associations, or LLCs that are licensed to operate adult family homes by the Department of Social and Health Services. Adult family home providers are considered public employees for the purpose of collective bargaining. If providers and their public employer reach an impasse on a mandatory subject of bargaining, they are subject to mediation and binding arbitration requirements. If the parties go to arbitration, there are certain factors that an interest arbitration panel must consider when making its decision. House Bill 1398 adds 2 additional factors arbitration panels must consider for disputes between adult family home providers and their public employers. Those are a comparison of wages, hours, and conditions of employment of publicly reimbursed personnel providing similar service to similar clients across the United States, and the financial ability of the state to pay for the provisions of the collective bargaining agreement. House Bill 1398 also adds 4 factors arbitration panels may consider in these disputes, including a comparison of wages, hours, and conditions of employment of publicly employed personnel providing similar services to similar clients across the United States, the state's interest in promoting a stable long-term care workforce that to provide quality and reliable care to vulnerable elderly and disabled recipients, the state's interest in ensuring access to affordable quality health care for all state citizens, and the state's fiscal interest in reducing reliance upon public benefit programs, including but not limited to medical coupons, food stamps, subsidized housing, and emergency medical services. I'm happy to answer any questions.
Thank you. Are there any questions for staff? Seeing none, Vice Chair Scott to speak on your bill.
Madam Chair, adult family homes collectively bargain their Medicaid reimbursement rates, and while this bargaining has helped to institute meaningful improvements in those rates, adult family homes continue to lag behind other state programs, state paid long-term care programs, in-home caregivers and child care workers have a provision in their collective bargaining rules that require an arbitrator to consider a comparison of wages and working conditions and the like for publicly reimbursed workers who provide similar kinds of care to healthcare consumers in Washington. And this bill is about ensuring that adult family homes are afforded the same consideration.
Thank you. Thank you. Are there any questions for Vice Chair Scott? Seeing none, let's call up our testifiers.
All right, first up we have Courtney Williams from the Adult Family Home Council, Dan Puravet from owner of the Bellevue Elderly Care Facility, and Alyssa Arley from A2Z Elite Services.
Thank you. When you're ready, please proceed with your testimony.
Thank you. And I think Alyssa is virtual today.
Yes,
okay.
Yes.
Okay. Good morning, Chair Barry and committee members. My name is Courtney Williams. I am the Advocacy Coordinator for the Adult Family Home Council. On behalf of the Adult Family Home Council, I want to thank Representative Scott for his leadership on House Bill 1398 and to the fellow committee members who have sponsored this piece of legislation. You will note that close to 1,400 individuals have signed in pro for this bill, and for good reason. House Bill 1398 modifies existing law under 4156-465 by including adult family home operators. Through this modification, Washington State is acknowledging the role of adult family home operators in the state's interest to promote stable long-term care workforce to provide quality and reliable care to our vulnerable populations. It is time to extend equitable considerations to adult family homes. In Washington State, over 5,200 homes who serve roughly 30,000 patients make up our adult family home workforce. We have grown rapidly since 2021, we've grown 58%. It is imperative we invest in long-term care and ensure we are accounting for the well-being of our growing elderly and vulnerable populations. House Bill 1398 is a critical step. Thank you for your time today.
Thank you. Please proceed.
Hi, my name is Dan Pravet, and I am an adult family homeowner and on the board of directors for the Adult Family Home Council. So I represent over 2,500 adult family homes that are part of the council and over 5,200 homes that are just in the state of Washington. I've been around this industry for 30 years. My parents started theirs in 1995. So I've seen, like that State Farm commercials, I've seen a thing or two in those 30 years. And this is one of the most important issues is how much we get paid for the Medicaid residents. Over 60% of the beds, I think, are Medicaid residents in adult family homes. I wish I could accept Medicaid residents right away, but I couldn't afford the care that we provide for our residents. We have a 5-year private pay contract until we can accept Medicaid. I hope this goes through. That way people like myself that are providers can accept Medicaid from the get-go, and it will help because, like she said, it's been growing. The reason the adult family home numbers have been growing is because we have the elderly population is growing as well, and we need more homes, more long-term care. Thank you.
Thank you for your testimony. Alyssa Arley, can you hear us on Zoom?
Yes, I can. Thank you.
Great. Please proceed.
Sure. Good morning, Chair Barry and committee members. Thank you for your time and allowing me to speak today. First, I want to thank Chair Barry and Representative Scott and all the representatives who have signed on to the support of HB 1398. Your leadership and dedication to this issue means a lot to the community. My name's Alyssa, and I'm a consultant in the long-term care residential space. I primarily help adult family homes develop in Washington State. From 2001 to 2014, I owned and operated my own home, and I really understand the needs of these homes. In 2014, I opened up my own consulting business, and I have now opened up over 2,000 adult family homes across Washington State, which I have also been in those homes. I'm here today to strongly support HB 1398, which seeks to provide equitable pay and recognition for all adult family home providers. Adult family homes are a cornerstone of Washington's long-term care, serving residents that have some of the most complex medical and behavioral needs. Providers are highly trained, licensed, responsible for ensuring high-quality care 24 hours, 7 days a week. Many providers are MDs, ARNPs, RNs, LPNs. Every degree under the sun are represented in adult family homes. This bill addresses the key issue, fair compensation. Over 65% of adult family homes are funded by Medicaid, but reimbursement rates fall far below what's needed to cover the actual cost of care. Staff are expected to meet high standards of training and credentialing, yet wages don't reflect their expertise and their dedication. What will HB 1398 do for us? It'll include adult family homes to ensure we're part of this interest arbitration, allow providers to negotiate equitable pay comparable to other long-term settings, which is critical, recognize the essential role that adult family homes play in Washington State's healthcare system. We go above and beyond. Providers care for residents who often cannot find placements, that have languished in hospitals for months and months and months until they find an adult family home that is able to take them on. Our staffing ratios are often a 1-to-3 because most adult family homes do not any longer have a 1-to-6. They find they need a 1-to-3 resident ratio because of the high level of complexities that we take care of. This will
Please
strengthen.
conclude your testimony.
Excuse me, sorry.
Please conclude your testimony.
This will strengthen the long-term care workforce by making wages competitive, support providers and staff so they can continue to deliver high-quality care, and acknowledge the vital work we do in Washington for all disabled residents as well as the elderly.
Thank you. Are there any questions for our panelists? Seeing none, thank you for your testimony.
Thank you.
And our last testifier, Vice Chair Scott.
Next up, we have Joyce Milwaukee-Pasil from the Datus Adult Family Home.
And it seems that she is not present on Zoom. So with that, are there any more questions on this bill before we close? Yes, Rep. Schmidt.
I have a question for staff. How So this would negotiate the rate that they're reimbursed from Medicaid? Is there a way to increase that reimbursement rate? Am I making myself clear?
I would have to get back to you on how that functions. This just changes the factors with which an interest arbitration panel has to consider when negotiations have reached that stage.
So they're considering using what the reimbursement rate is in part of that equation, but it's not, there's no way they can actually raise that reimbursement rate, correct?
I would have to get back to you on
Okay, all right, thank you.
Thank you. Please send that to all of us when you have an answer. Anything else? Okay. All right. Thank you. With that, we'll close the hearing on 1398 and open the hearing on HB 1402 with a staff report.